Assalamu alaikum everyone. Today we are going to do a quick pharmacology review over beta blockers. First we have to know the classification of beta blockers. There are two types of beta blockers: non-selective beta blockers and selective beta blockers or cardioselective. Non-selective beta blockers include propranolol, timolol, levetolol and sotalol. And selective beta blockers include atenolol, bisoprolol, metoprolol and asmolol. So here is an interesting fact. As we can see, at the end of every beta blocker there is an OL. So whenever we will see OL at the end of any medication, we are going to understand that it is beta blocker. Beta blockers used to treat a lot of things such as hypertension, ischemic heart disease and arrhythmias. These are cardiovascular diseases, but it can also used to treat non-cardiovascular diseases such as glaucoma, migraine, hyperthyroidism and tremors. So now we are going to understand how beta blocker works. It blocks beta receptor sites, so norepinephrine and epinephrine can't bind to receptor sites and elicit the sympathetic nervous system. So now we are going to know the side effects of beta blocker. Bradycardia. As we know that beta blockers tend to slow the heart rate way too low, so that can lead to bradycardia, and it can also lead to heart block, second degree or third degree heart block, and it can also worsen asthma or COPD, especially in non-selective beta blockers. So if your patient is taking any non-selective beta blockers, so keep that in mind. And it can exacerbate heart failure, and it can also cause hypotension and orthostatic hypotension. So here comes the most important part, which is nurse's role. You have to monitor heart rate and ECG and BP of the patient, and you can also look for the signs of heart failure like jugular venous distension, weight gain, swelling and dyspnea. And as a nurse, you must taper off the patient's beta blocker. You can just withdraw the medicine, you have to taper off. And it can also mask hypoglycemia because it tends to slow the heart rate. There is a side effect, bradycardia, but diabetes patient actually understands when there is tachycardia going on their body. They understand that it can be hypoglycemia, so it can mask hypoglycemia.